Sono Francesco Zingari.
Good morning, my name is Francesco Zingari and I am a dentist. In my daily practice, I predominantly focus on surgery, reconstructive bone surgery and implantation surgery. Well, first of all, I would like to thank Mrs. Clara Madelia for hosting me in this wonderful conference. Palazzo Bovara is a beautiful building. Well done, well chosen. It is a building that best describes the neoclassic culture in Milan. Milan is a city that certainly attracts many diseases in medical sense. Think about Professor Veronese's Tumor Institute, for instance. But this is a conference about ethics and food. I am a dentist. I focus on teeth. Teeth are necessary to eat. Ethics means thinking about what you do, thinking about the reasons why you do something and you make your choices. I strongly believe in ethics and I believe in teamwork. Today I shall talk to you about ectodermal dysplasia, a rare disease that we take care of with my team. I work at Istituto Ortopedico Galeazzi. It is a research institute. And in our hospital, back in 2005, we started taking care of the very first patients suffering from ectodermal dysplasia, a disease that is caused by the agenesis of dental elements. That is, agenesis means that there is no dental follicle. The lack of the dental follicle is a disease. It's a pathology. In some cases, it may not be very relevant. For instance, I am lacking 2 permanent teeth. I still have 2 infantile teeth. They've not been replaced by my adult ones. But this is a minor disease. However, there are patients who lack many dental elements. Sometimes all of them, they have no teeth at all. And this is a very serious problem. The pediatrician is, of course, the first interface when the pediatrician realizes that a child is missing many teeth. It is necessary to carry out a genetic screening to unveil the disease. The Sacco Hospital in Milan takes care of the genetic screening for this disease. Once it has been confirmed that the disease is genetic and it is X-linked, which means it pertains to the predominantly male chromosome, this is to say that male suffer from the disease with a higher incidence than female, we have the hyperplasia of the ectoderm. We start as a zygote, we become a blastula, then a grastula, and then we divide in 3 embryonal leaflets, the ectoderm, the mesoderm, and the endoderm. And that's how human beings develop. If I have a hyperplasia of the ectoderm, I have the hyperplasia of all those elements that will make up the skin and the adnexa, i.e. the nails, the hairs, and so on and so forth. The hypoplasia of the teeth and the hypoplasia of sweat glands. Sweat glands play a very important role. Many, many years ago, when the disease was unknown, there used to be children who died because of a simple high temperature. In the case of hyperthermia, glands allow us to sweat, therefore controlling the body temperature. The partial or total absence of glands, hypotrichosis that can also be partial or complete, meaning the lack of hair bulbs, which means little hair, little hairs, very little eyelashes, maybe very, very fine, blondish in color, and the complete hyperplasia of teeth. So children showing agenesis issues very often show dental elements that have a cone shape. The conoid shape affects the central, the lateral teeth and the incisors as well. During the first phases, during infancy, this disease is a very important one. Children with very few teeth or no teeth at all have to start wearing false teeth. Prostheses that are anchored by means of glues, pastes, hooks hanging on to the few residual teeth. So I'm talking about something really serious. When children go to school, they do not manage to eat properly in the school canteen. They do not manage to speak properly. They can't be submitted to an oral test at school because they cannot speak. And I've been following a child who, at 10 years of age, has the following dream. His dream is to go and eat at McDonald's. I apologize for mentioning this because we're talking about healthy food here. Anyway, that's his dream because he's 10 years old and he's still eating liquidized or homogenized food, baby food. The logopedist, the speech therapist, has to follow him because due to the false teeth in his mouth, he cannot speak properly. So the first interface is the pediatrician, and if these dental elements are missing, it means that when the patient is 16, 17, 18, when the patient becomes an adult, at the age of 16 for women and 18 for men, they will be lacking some bony structures, and the typical face, I'm sorry I cannot show you a picture, but the typical face of a child suffering from ectodermal dysplasia is characterized by a very wide and high front. The nasal columella is flat. The chin is protruding and the molar part of the maxilla is hyperplasic, depressed in other words. And compared to a patient who hasn't got dysplasia, the shape of the skull is concave. A normal person has a convex shape because of the existing bone structure. These patients have a concave bone structure with a prominent chin, no molar bones, and the X-ray, the lateral X-ray, will show you a totally convex skull shape. Thanks to reconstructive surgery, it is now possible to think about regenerating bone tissue. Well, this is much easier if patients do not have any teeth right now, but had teeth in the past. Because if I use my muscles, they do not become atrophic. I can use my legs if I've always been using them, but if I have nothing, because I've never had it ever since I was a child, the atrophy is much more severe. So what can physicians do for these patients? Well, we can make use of fixtures. These are dental implants that replace the missing dental roots. I can do this in a non-dysplastic patient, and it is difficult but manageable. Conversely, if the patient suffers from ectodermal dysplasia, things become much more difficult because the lack of bone from the very beginning has caused a significant discrepancy between the effective position of the teeth and the effective position of the bone. So there is a discrepancy between the fixtures with the teeth and the bone. So at maxillofacial surgery at the Ortopedic Institute Galeazzi, we augment the bone, we add bone. In some cases, we even transpose or shift bony fragments to try and restore the normal face structure. I do this together with Dr. Grechi, our chief doctor, and together with Dr. Mancini Evangelista, the president of ANDE Onlus. ANDE is the National Association of Dentists. It is a non-profit organization that in 2005 started bringing the first dysplastic patients into our hospital. This was possible thanks to ANDE, the National Association for Ectodermal Dysplasia, that was set up thanks to the efforts of a few families. Julia Kerman is one of the founders. She also suffers of ectodermal dysplasia. And these associations represent the Italian patients suffering from ectodermal dysplasia. With the advent of internet, many families got to know about our hospital focusing on this disease, and the number of our patients has increased significantly ever since. There are approximately fully blown cases, 7,000 fully blown cases worldwide. We have 450 fully blown cases in Italy. We have treated approximately 53 cases. That is, 53 cases have been concluded and some are still work in process. So thanks to the ANDE Association and thanks to ANDE Onlus, we today manage to cover the costs. Costs are very high. Fixtures, implants, prosthetic elements are all very expensive. The management cost is very high. But thanks to these two associations, and thanks to our chief medical doctor and the different physicians of our multidisciplinary team, we can provide patients with a completely free of cost treatment. So on Wednesday morning, we're there for our patients. We visit them and we organize our therapeutic plan. Why do we do this free of cost? Well, we have to do this free of cost because this is a rare disease, and the basic benefit package of the region of Lombardy and of the whole Italian state does not even mention this disease. So patients suffering from ectodermal dysplasia are reimbursed only for the first visit, which is nothing compared to all what they have to go through. Please let me quote what a patient with ectodermal dysplasia told me many years ago. Francesco, you changed my life. Today, thanks to fixtures, I can finally speak, eat and have a decent, normal social life. Thank you very much.